This screencast discusses urine storage and micturition, which may be found in Chapter 15 of your textbook. The objectives of the screencast are as follows. Explain how urine leaves the collecting ducts of the kidneys and arrives in the urinary bladder. Explain the function of the urinary bladder. Describe micturition and the Micturition Reflex. Describe incontinence and list possible causes. Describe urinary retention and list possible causes. In the previous screencast, we learned that nephrons, found here in the kidneys, are responsible for the formation of urine. That urine formed by the nephrons passed into the collecting ducts. There it is concentrated, and the collecting ducts of each medullary pyramid convey the urine into a calyx. And then the various calyces of the kidney dump the urine into the renal pelvis, which leads to the ureter. The ureters, which extend posterior to the peritoneum, allow urine to be transported from the kidneys to the urinary bladder under the pull of gravity with some assistance from peristalsis. Urine then enters the urinary bladder through the ureteral orifices. Urine is formed continuously by the kidneys even when one sleeps. In a 24-hour period, the kidneys have filtered somewhere between 150 and 180 liters of plasma through the glomerulus, and that urine is stored in the urinary bladder temporarily until the appropriate time for its removal. So in other words, the urinary bladder prevents you from having to leak urine all day long as your kidneys produce it. Imagine how impractical or difficult life would be if you walked around leaking urine. When you sat, you leaked urine. When you slept, you leaked urine. So the bladder allows that urine, as it's being made by the kidneys, to be stored temporarily, and then when it's an appropriate time, you are able to void it from your body. The urinary bladder is basically a muscular sac which is capable of extending or stretching as it is filled and then collapsing as it is emptied. The wall of the urinary bladder contains 3 layers of smooth muscle, and lining the urinary bladder is transitional epithelial tissue. The layers of the transitional epithelial tissue slide past one another, allowing the epithelial tissue to thin out as the bladder fills and is stretched, and to become thicker as the bladder collapses as it is emptied. An empty urinary bladder is about 2 inches long. As it is filled, it extends superiorly, such that a moderately filled urinary bladder, one that contains about a pint of urine, extends an additional 3 inches to a total of 5 inches in length. As the bladder stretches and holds more urine, there is very little increase in internal pressure. Micturition, or voiding, is the process of emptying the urinary bladder and allowing the urine to pass out of the body. Of course, men have many different names for this process, including draining the lizard, going to see a man about a horse, knocking the dew off your lilies, or simply taking a leak. Now let's talk in detail about the process of micturition. During micturition, urine leaves the bladder through a slender muscular tube called the urethra. The opening from the bladder into the urethra is called the internal urethral orifice, and it's controlled by a smooth muscle called the internal urethral sphincter. Once urine enters the urethra, it can only pass out of the urethra and out of the body if the external urethral sphincter, which is composed of skeletal muscle, relaxes and allows the urine to pass through. Since the process of urine moving from the urinary bladder and through the urethra to the outside world is controlled by both smooth muscle and skeletal muscle, micturition has both an involuntary component and a voluntary component. Now let's discuss the micturition reflex, which is responsible for the process of micturition. During the process of micturition, urine leaves the bladder through a long, slender, muscular tube called the urethra. The opening into the urethra from the bladder is called the internal urethral orifice, and it's controlled by smooth muscle called the internal urethral sphincter. Another set of muscles called the external urethral sphincter, which is composed of skeletal muscle, controls the exit of urine from the urethra to the outside world. Obviously, since smooth muscle and skeletal muscle are both involved in this process, micturition has both an involuntary and voluntary component. The process of emptying the bladder is accomplished by the micturition reflex. As urine enters the urinary bladder, the walls of the bladder are stretched. Stretch receptors are activated when about 200 milliliters of urine have entered the bladder. In response, these stretch receptors send sensory impulses to the sacral portion of the spinal cord. Motor output is then sent back to the walls of the urinary bladder, causing the detrusor muscles, those smooth muscles, to go into reflex contractions or spasms. This forces some urine through the internal urethral orifice into the urethra. It is at that point that one feels the urge to go. With urine now in the superior portion of the urethra, we enter the voluntary portion of micturition, which involves the external urethral sphincter. If it is convenient to void, then one simply relaxes the external urethral sphincter and urine is flushed from the urinary bladder. However, if it is not a convenient time, then one simply fails to relax the external urethral sphincter so it remains closed, and within a couple of minutes the contractions stop. However, after another 200 to 300 milliliters of urine enters the bladder, the micturition reflex is activated once again. As you are probably aware, micturition cannot be suppressed indefinitely. Eventually, it will occur whether the person wants it to occur or not. Now that you have a basic understanding of micturition and the micturition reflex, let's discuss a couple of dysfunctions of micturition. Incontinence is the inability to control the external urethral sphincter. In other words, it's a loss in the ability to control when and where micturition occurs. It is quite normal for a child less than 2 years of age not to have full control over the external urethral sphincter. And that's why pediatricians typically will tell you not to expect your child to be fully potty trained until they are 2 years of age or older. During pregnancy, the growing fetus puts pressure on the urinary bladder, and As a result, there is somewhat a loss of control by the expectant mother over that external urethral sphincter. Nervous system problems, of course, such as cerebrovascular accident or spinal cord injury, will reduce one's ability to control the external urethral sphincter. And lastly, removal of the prostate or even radiation therapy to the prostate can cause incontinence. However, in most cases, it's temporary, with most control or total control returning within a year after the procedure. Another dysfunction of micturition is urinary retention, or the inability to empty the bladder, even when the bladder is full. This is quite normal following general anesthesia, which is administered during surgery, as it takes some time for the smooth muscles of the bladder and urinary tract to fully regain their functions. In older males, enlargement of the prostate can also cause urinary retention. If you look at this figure, you'll notice that the first segment of the urethra passes through the prostate. If the prostate is enlarged, as shown on the right here, it can completely collapse the lumen of the urethra. As a result, very little, if any, urine is allowed to pass through the urethra. If urinary retention is prolonged, there is significant risk of trauma to the walls of the bladder from excessive stretching, and it might be appropriate to install a catheter. A catheter is a slender, flexible drainage tube. It would be inserted all the way up the urethra into the bladder, and there a balloon is inflated to hold it in place. This would allow drainage of the urine from the bladder through the urethra and out of the body. Now let's review the objectives of the screencast. Explain how urine leaves the collecting ducts of the kidneys and arrives in the urinary bladder. Explain the function of the urinary bladder. Describe micturition and the micturition reflex. Describe incontinence and list possible causes. And lastly, describe urinary retention and list possible causes. The topic of the next screencast will be water and electrolyte balance.